Good morning, everyone. Happy New Year because this is actually my first video recording for the year. And today we'll be talking about what is pseudothrombocytopenia and how to identify it when we do our CBC or full blood count tests. Now, pseudo is false. Thrombocytopenia is reduction in platelet level. So both of them added together is false reduction of platelet level on CBC. Getting pseudothrombocytopenia on our CBC may be a little bit difficult for identification because we trust our CBC so much that whatever result that comes out of it, we just dispatch. But now, for you to be able to identify this CBC, we need to check some parameters. First, I always check for the WBC. I check for the MPV, the P platelet distribution weight, and also PLCR. Now, when we start having pseudothrombocytopenia, this is due to the fact that we collect CBC tests from EDTA anticoagulated container. This EDTA prevents or chelates calcium, preventing the activation of uh, clotting, that is coagulation cascade, thereby preventing blood from clotting. Now, also, it is good and suitable for CBC tests, but it is not perfect for platelet count. In some certain situations, we end up having incorrect platelet value, thereby leading to thrombocytopenia. Now, for us to be able to identify this, we check for our MPV. Platelet count may be low, MPV will be showing a high or a normal range. MPV actually tells us that this platelet is normal in functionality, that is, there is granulation in this platelet. Whereby reduced MPV tells us that there is degranulation of platelet. Now, in reduced platelets, especially for those with immuno issues, we should be seeing degranulation of platelets. And secondly, another thing we check is the PDW, platelet distribution weight. Now, this may be high. When you see a high PDW and you are seeing a low platelet count. Another one is the PLCR, a high PLCR, but you are seeing a low platelet count. For us to be able to correct this, we go into doing peripheral blood film, where we view under the microscope to see for clumping of platelet count, clumping of platelets. Now, sometimes you also see satellite cells, that is platelets forming satellites around neutrophils. Then another thing, again, we should check out for is abnormal distribution of platelets. Now we review our film and this will confirm if the person is actually going through pseudothrombocytopenia or is actually a diagnosis for pseudothrombocytopenia. Another means again is by collecting this patient's blood and running it using sodium citrate anticoagulated container. We run it on our CBC machine and we check for our platelet value. While sodium citrate chelates calcium, preventing clotting of red blood cells, it also makes these platelets more flexible and relaxed, allowing them to feel normal, if I should use that word, in the suspension of blood. Now, when we run this test and we're able to get a normal value for the platelet, this tells us that the result we initially had was actually pseudothrombocytopenia. Now, we should not diagnose pseudothrombocytopenia using only CBC results or full blood count results. We should always make our film and view and check to confirm pseudothrombocytopenia or thrombocytopenia. Now, those that actually suffer from thrombocytopenia are mostly those that have undergone serious or severe bleeding. Yes, severe bleeding can lead to thrombocytopenia. Like I said initially, a falsely elevated or falsely reduction in platelet level can cause a false elevation of WBC count. Yes, because this machine may identify these clumped platelets as small fragments of lymphocytes. Yes, thereby counting it among lymphocytes, increasing the level of lymphocytes, at the same time increasing the total WBC count, giving us a falsely elevated WBC count. Then, like I said, we should check for our peripheral blood film. Then those that actually, the more common causes, if I should use the word, the common causes of this thrombocytopenia, I've mentioned EDTA use. We also have cold agglutinin. Number three is autoantibody against platelet glycoprotein. And number four is infection, then autoimmune disorder. Now, a quick key point or take home of this particular topic is that we should never diagnose pseudothrombocytopenia using CBC. We should always check for our blood film, especially when platelets are low. Then we should always confirm using a sodium citrate anticoagulated container. So I hope this short video gives us a sight on what pseudothrombocytopenia is and how we can correct the values and get an actual count for our platelet level. Have a nice day. I still remain your able scientist, Jude, OCJ Star, the one and only. Please do well to like and share and drop your comments, your reviews, your likes and your dislikes, so I will be able to improve in my video making and reach out to more people. Have a nice day. Thank you. Bye.